Hi, I'm Dr. Ed Canzati. I'm a clinical director for General Dental and a practicing dentist in Vancouver, Washington. Oral health affects not just our teeth and appearance, but can have an impact on heart disease, diabetes, cancer, infectious disease, birth complications, and much more. At General Dental, we understand the impact oral health has on overall health, and we take a complete health dentistry approach to care. You'll understand why after viewing this segment on how oral health affects your overall health.
I would be able to, be drowsy because without a good night's sleep, it just like I could be driving like this, I'd be okay, and then get to a stoplight and waiting for the stoplight to turn. My eyes just get real heavy, and I'd be like just sitting there stopped, and then the car behind me would be honking and be like, "Oh, the lights changed. It's time to go."
About 2 years ago, my life was much different than it is today. I was not sleeping well at night, and it was starting to affect other parts of my life. I was at work, and I dozed off between telephone calls, and I did get in trouble for snoring at work.
I was probably in about the worst condition of my life, being obese and with the untreated sleep apnea.
At the highest point, I was about 285 pounds.
But yeah, that's probably me, about 75 pounds heavier than today. I was wearing 42s in pants.
It was like having a ball and chains or a weight strapped to me that I was just having to carry with me every day. I went and saw Dr. Jeffrey Lowe. I was just in there to do routine cleaning, and they were talking about how I slept. One of the questions was when you're having a conversation, much like what we are now, and that was one that would be, something that could be likely for me to feel drowsy or doze off. And I said, yeah, I've done all of these things.
So we had him take the home sleep monitor home, and he took the test, found out he had severe apnea. Nothing we can help him with here, not with appliances that we can create, but we did refer him to the hospital, who, after many phone calls, found the sleep physician that could help him, and they got him on a CPAP.
My AHI was over 100, which essentially AHI just means how many times you stop breathing during an hour.
And he swears we saved his life. He's lost weight, started to exercise. He just could not feel better because he went to bed rested and woke up tired instead of going to bed tired and waking up rested. So he couldn't even fight his day.
It's nice to know I can be a functioning person of society and not have, other complications or not feel tired. That's the big thing, is just to have energy throughout the day. I started becoming more physically active, and then I bought a bicycle, and now I ride the bicycle almost every day. New Bob is definitely different. For one thing, all of the questions, how likely I am to fall asleep, and all of those conditions, it's always a never now. So I get to check never. I've dropped at least 10 inches just in my waist size. In fact, the weight was coming off so fast at first. It was like every couple months I had to go and buy new clothes again. I feel like the way that the dentist views complete health, instead of just looking at me as a mouth, but as thinking of me as a person, has been instrumental in my transformation.
And I think that's what's missing, is just a conversation. The fear that, well, if I talk to him about sleep apnea, he might go someplace else and never come back to this practice. We don't have that fear. We have the, what if he doesn't get his sleep apnea treated? What if he doesn't make it to 50? What if he ends up with high blood pressure and is eating 4 different types of medicines? What if could be easily just treated by letting the guy get some air while he sleeps? Because that's what's happening every day in this practice.
Hi, this is Dr. Ed Canzati again. I hope you learned something from this segment. It's clear that oral health has a direct impact on many health conditions. At Gentle Dental, we have taken this message to heart and recognize the role that our dentists and hygienists play in helping our patients maximize their overall well-being. That's why we give our clinicians additional training in comprehensive exams designed to screen for signs of underlying health conditions, including oral cancer, heart disease, and diabetes. While this is not a replacement for a medical exam, the fact that we typically see patients more often than they see their physician puts us in a unique position to help identify potential early signs of underlying problems. We at Gentle Dental embrace the complete health dentistry approach to care and hope you do too. For more information on Gentle Dental, visit www.gentle1.com or call us at 855-GENTLE7. Thank you.